Hey there, my name is Vaughn, and this is the Vaughncast Show. This is a podcast that focuses on mental health, breaking societal stigmas, harm reduction, addiction, and recovery. If you like what you hear, subscribe and leave a review on Spotify and Apple Podcasts. Also, follow the podcast Instagram at the Vaughncast Show, where I post video content from the show. All right, let's get into today's episode. Now, okay, welcome to the Vaughncast Show. Hope everybody's doing well today. I'm your host, Vaughn. Today I have licensed clinical worker Candace Curzon and medical provider Austin Francom with me. Talk about ketamine therapy. How are you guys doing today?
We're good. Thanks for having us.
Yeah, good.
Appreciate it.
Yeah, thank you.
Yeah, no problem. So today we'll be talking about ketamine, its properties, and how it's used in a therapy setting. See, ketamine has a special place in my heart. I'm a recovering addict, and I've definitely dabbled ketamine. It's really interesting stuff, so I wanted to talk more about that. But it interests me because I didn't realize that you could use it for therapy up until a couple of years ago. I thought it was just like recreational use.
Mhm.
And yeah, so how did y'all end up getting into ketamine therapy?
So I'm a trauma therapist. I've been doing it for about 12 years. And I worked in a mental hospital here in Utah, and I saw really great results with patients, people who hadn't responded to anything, treatment-resistant depression, who weren't responding to anything, who would have incredible changes after one or two sessions of ketamine. I became really interested in it and started learning all I could about it. And I got a little burnt out with being at the hospital and just doing the initial crisis work with people. I wanted to do more and kind of dig in deeper and follow them through. And so I opened my own practice, still just focused on a lot of trauma work, mindfulness, and then trauma work. And I sent a couple of my patients to another clinic, and I was seeing incredible changes really fast. Like one or two sessions, their affect would change. They'd be smiling. We could start to actually really dig into stuff we hadn't been able to dig into. And so I reached out to Austin, who's a medical provider, and I just asked if he wanted to give it a try. So he got some ketamine in his clinic. He's a family practitioner, and we just started practicing on our own patients who'd had experienced treatment-resistant depression. It's just kind of gone from there. That was about 6 years ago.
Yeah, I similarly had a lot of patients that just were refractory to medication, like conventional meds weren't working. So it was worth trying something outside of the box. And we both found it, similarly beneficial for our patients. So
Interesting. Okay, that's pretty cool. So it's mainly used for like trauma and depression. But how does that work? Like, what is ketamine and how does it affect the body? Because there's so many like things. Oh, it's horse tranquilizer, it's cat tranquilizer. There's so many like misinformation stuff out there. Oh, you're doing horse tranquilizer. That's weird. What exactly is ketamine and how does it affect the body?
So ketamine is actually an anesthetic drug. It was kind of developed in the 60s for, field use because it's very safe. It doesn't affect your airway, doesn't affect your breathing or your blood pressure, stuff like that. At low doses, it's essentially a psychedelic drug. And for whatever reason, and there's some theories, popular theories on that helps with mental health. But it does tend to put patients in a state of openness where they can kind of examine, whatever issues they have, their trauma, without self-judgment, without, that negative self-talk that sometimes comes with our conscious mind. So that there's debate on how it works. There's their mainstream medicine kind of feels like maybe it's just the drug's effect on neurons. We kind of feel like it's more experiential. And there's theories to support both things, but there's a gap in the knowledge of how it works. It just seems to have kind of a almost profound effect sometimes on people.
Right. And I'm curious too. For those who don't know, ketamine, it's like a crystal. And for recreational use, typically you sniff it up your nose. How does that work in the therapy setting? Do you inhale it through your nose, like sniff it, or is it like ingested orally, or is it like through an IV?
All of the above, really. For us, we offer either intramuscular injections or IV. You get a more of a you get a little more powerful effect if you do it intravenously or intramuscular, where it tends to, anything you ingest, either nasally, a lot of that tends to be processed through your liver, which metabolizes it quickly. So you get kind of a different effect from lozenges or nasal administration. You get it's more like maybe a sedative hypnotic state with that administration. With the IV or IM injections, you tend to get a little more of a dissociative state, a kind of an out of body experience. So for kind of an immersive experience, we tend to recommend intramuscular injections. For doing ketamine assisted therapy, where you would talk to a therapist through the session, we recommend either lozenges or slow or a subcutaneous injection, which is metabolized slower. But ketamine is a strange drug because it's metabolized really fast. So if you ingest it or inhale it, it tends to slow down the metabolization. So, and that affects kind of how the drug, the pharmacokinetics of the drug tend to be different depending on the route of administration. I know
Yeah. No, that was well said. I had no idea. I was always curious. I'm like, so am I like chopping up like ketamine lines and doing it in therapy? Like yeah, yeah, and it kind of burns too. I was like, that's interesting. Like, I always wondered, like, because I guess there's
cleaner way. We do clinical in the office.
The nasals, there's actually a commercial preparation called Spravato that's kind of a derivative of the ketamine we use, but because it's if you dehydrate it, I think you'll get kind of that crystallization, kind of what you're kind of describing. But that's really would be more of a people that use it recreationally. And I think there's a little bit of association with that kind of administration, particularly people with maybe a background with, have struggled with addiction. I think that can be a little, so no, we don't usually do the nasal administration, but I think professionally when it's done, it's usually dissolved in a solution. I think it's more to avoid kind of the triggers of people who maybe do have a history of addiction, typically professionally, nobody would do it in a line form, I guess. It would be the way to phrase that, I guess. So.
Yeah, I had to get it out there because I always wondered. It's weird. Back then, this is a long time ago. I don't know if this is appropriate, but like it would never be around a lot. It's a very niche thing in the recreational like culture. Like you don't get it everywhere all the time. So when someone has it, oh yeah, let's get some. And it sometimes comes in a vial, pretty much in powder or like in a crystal, or people will say, oh yeah, let's get like a hair dryer. Let's like put in a low setting, let's cook it up, or put in like a low flame, like setting in like a pan and cook it up and you see like crystallized. So yeah, I always wondered like how that works. And yeah, I can see how that'd be very triggering if you're an addict, because I don't know. I think the first thing I said to like my previous therapist, I came in for addiction issues. I work a 12-step program, but I was like, oh, so I can essentially like, can you like hook me up like MDMA, like therapy or like ketamine treatment? And she kind of laughed because in my head, I'm like, oh, maybe I can like get high doing this and do therapy. So yeah, in low doses, I felt like I get giggly, right? But then when when I ingested a lot more, definitely disassociated, and I was like not hallucinating, but it was very trippy. Like I became colors in a sense, where like I just kind of lost like who I like. The ego was like ego death in a sense. I
Yeah.
experienced that. Yeah.
Yeah. That dissociation, I think, is kind of important. And what you're describing is kind of, a euphoric effect, but in a, you know, uh, you know, I guess if you're doing it in a recreational setting, I don't know if it's it has a history as being a club drug in the 90s. For in a therapeutic setting, though, it's not always euphoric. Sometimes it can be, it can be actually very scary, even kind of challenging emotionally. And, um, it does have some abusability. I mean, there's a potential for abuse there. Um, I think the crystallization, it's the molecules combined with hydrochloride when that's water soluble. Most drugs that are, the are dissolved in a solution. If you dehydrate them, will form into some type of crystal. I think that's probably true of like, I don't know, you know, uh, cocaine or anything dissolved in a solution, because it dissociates from that chloride molecule, but when it's dehydrated, it combines back into a crystal. So most drugs will kind of appear as a crystal form. I guess if just from a chemistry standpoint, if you dehydrate them, but I don't know if just if you're curious, I think that's kind of how that works.
We've had we've had a few people we've had quite a few people come who are in 12-step programs. That's always been a little, they'll ask about that. Like I'm abstinence only, and there we had some people kind of work through that, and some people are absolutely abstinent only and don't want to go this route, but the ones who have come in, I think they found some benefit with it, and it approach it a different way than using just getting high or drugs. There's the way I like to describe it is it's a container for you to go. Ketamine offers you a container to go in and do your work in a really safe way. And yeah, you do feel high, but it's not like other drugs where you just get high. They're coming in to do some work. And so we've had quite a few people use it in that way who are in 12-step programs, but they kind of have to work through a little bit of that mental block they have with abstinence only. But it's can be really good because it helps you. Doesn't just stop you from doing all your stuff, whatever, if they're coming in for addiction, but it can help them really gain insight into why they have that addiction. There's usually a reason, usually trauma-based, if it's and so it's like alcohol or opiates or even smoking. We've had people come in for that. But it really can help them get to the root of why they do it. And that's why it's a little bit different than just like getting high. MDMA offers that same thing, and I think that's a great medicine also, but it's off the table for us right now because of the legality of it. But, and this one's always been legal. It was never, a Schedule I drug. And so we've always had access to this. And so there's a little bit of a different feeling with this because it's always been legal and always been available.
I would say in comparison to MDMA is more euphoric than ketamine in general. Ketamine, depending on what you're using it for, will take you a different direction. So, but yeah, I kind of describe ketamine as a roadmap. It doesn't do the work for you, but it'll sometimes give you a roadmap on where you want to put your work. And we kind of frame it like that for our patients.
Yeah, because when I was even doing it recreationally, like I had to be in a different setting. It wasn't just something you can like do. You can just, I don't know, it was a little different. I got sometimes emotional. Like I've seen friends just like, maybe there was something that friend and I, like we kind of like drifted and we were doing ketamine. She started apologizing for a lot of things. I think it brought back a lot of, oh, I'm so sorry we did this, but no, it's okay. It's all good. We became very empathetic. We had that connection, but yeah, it's really interesting stuff. And with the 12-step, I think for me in my head, it's like, well, like you said, it's through like a therapist use. In 12-step, you can use like painkillers if you really need to, right? Like you wouldn't break your sobriety if it's prescribed by a doctor as long as you don't abuse it. Now I'm thinking with the ketamine, maybe it can be the same thing if it's administered through a therapist or just it's guided in a professional setting. You wouldn't break anything. But also too, what if in my head I was like, what if I do ketamine therapy and then I'm like, oh, I'm recovered from drugs. And then in the back of my head, I'm like, well, maybe I can do drugs again because I'm recovered. I'm not an addict anymore. Does that ever come across from some people?
I mean, that kind of rationalization, I think is, I think we all do that. And I think addicts do that as well. So I'm sure, has that ever happened? Yeah, I think there's people that are like, I got this, I can use more moderately. And that's kind of an old lesson I think people have to learn over and over again. I don't know if ketamine would, I think ketamine has a certain amount of, whatever it shows you inside your own mind, there's a certain amount of honesty with it. So I think that sort of rationalization, for someone to pull that out of a ketamine experience, I think that's probably an old story people have told themselves with their own addiction, that they got this, I can go back to kind of moderately doing something. And that's a lesson a lot of addicts have to learn over and over again. As I'm sure you know that, but yeah.
Yeah. It's really interesting stuff. And I didn't realize it's legal. It's funny. A buddy of mine's back then was like, oh yeah, I can pass a drug test because ketamine is not on they don't look for that. So maybe that's why it's considered legal. Like they don't really check for that. It's still like niche.
But it's always been around as an anesthetic. So they never were able to put it as a Schedule 1 because there's always been some medical use for it. I mean, it's one of the essential anesthetics, right?
But I would say probably it's just not common, because, for example, I'm sure some drug screens will screen for like benzodiazepines or opiates, and oftentimes those are legal drugs as well. So it probably, just because it's newly more popular, is probably why it's being screened more, or hasn't been historically screened. I would say it's also quickly metabolized, so it would be difficult to catch on a drug screen. So it just hasn't been, I guess this is more to the point of safety of ketamine. It hasn't created some social problems that, let's say like cocaine or opiates have caused. So I think that's probably why it's not typically screened for. But the legality, sometimes there are legal drugs that you can fail a drug screen on, and that is, so yeah, it's probably more that it's just historically hasn't been a social problem, so it's not routinely screened for.
Right.
But I still say, even though it's more popular, I would say hasn't created social problems like opiates. I think in my mind, opiates have created a lot of social problems, particularly lately.
100% with the fentanyl and everything. So talk us through the ketamine therapy process. Like, how does it work? I imagine like someone administers, gives you ketamine, you take it, and then you go from there.
Yeah. So we have offices that are like therapy offices. We're in a medical office, but we try and offer really comfortable. The setting is very important with these medicines. And so we try and offer a really comfortable space. People have a couch or a recliner, and then they have their own space, and we go in and we chat with them a little bit. And there's a process to get them in there, screening and making sure it's the right thing for them. But once they get to our office, we get them in their room and chat with them a little bit, do their vitals, and then they'll either get an injection or an IV. They'll have the space for about 2 hours. They get the medicine, and it takes about, depending on the route of administration, it takes anywhere from 3 to like 10 minutes to feel it. And we just get them really comfortable, lay them on a couch and give them eye shades and music and a blanket. And just, we can't control what the medicine and the patient do, but we can control the setting. So we're just there to support them and help them through and keep them as comfortable as possible and safe. Generally, it looks like somebody's just resting. Their eyes are closed and they're just resting. Sometimes there's a little more action going on. It can be disorienting and can be scary. It can be really beautiful too. And most of the time we're just there. We're checking in on them multiple times and have our eye on them the whole time, but we're giving them their space to just kind of go where they go with it. And the deepest part of it, depending on the route of administration, is about 30 minutes to an hour of the deepest part of it. And then they have another hour to kind of come out of it, come back to themselves, and then we'll check in and do some processing. So that would be like the way we do like an immersive session, where the majority of what we do is somebody come in for an immersive session. People can also choose to have a therapist sit with them the whole time, and just be fully supported. And in that case, we do a little bit lower dose so that they still have one foot in this world and they're able to talk and access what they need to. And I'll chat with them before and see kind of what we're working on. Sometimes I know them, sometimes I don't. If I don't, I'll spend a little more time talking about their history and what they want to work on. And so that's called ketamine-assisted psychotherapy. That's a little different than the immersive session. So I or another therapist will sit with them and ketamine really will open you up and allow you to have access to emotions and sometimes memories. Usually it's like emotion and just like being open and being able to talk about your stuff in a really open way. And so that will generally be about the same amount of time. The deepest part of it being about 45 minutes to an hour, but it's a little bit lighter and we're doing deep therapy. And I'm just kind of guiding them and holding space for them while they are there doing their work. So those are the two ways we offer it or we do it. So yeah.
Right. You said something earlier that was interesting. Music. How does that play a part? Because for me, it was weird. Sometimes when I was on it, I would just watch music videos and it felt like I was in the music video. It was kind of trippy, but what does music have to do with the therapy part?
There's different theories on that as well. Everybody is pretty passionate about it because, there are, we feel like music can kind of help you move through the session. And particularly if you kind of get stuck on a thought or kind of feel like you're trapped in, kind of in a dissociative experience, sometimes music can kind of help push you through or keep you grounded. And we offer a couple of curated playlists if patients don't know what to listen to, but I don't know. I kind of, sometimes patients listen to stuff that they have a connection with, usually about, so we don't discourage people if they want to kind of, tailor their experience to what they want to try listening to. But we always have backup playlists if it's too weird for them or something. So, I think we just think it helps keep people grounded, but it's really an important part of the experience. It kind of helps you kind of just move through the experience.
What's nice about ketamine is it's very fast acting. Music, you can be going one way on one song. It'll take you somewhere. And you're just going that way. And then the song changes and then you just completely change directions and go work on something else. It's just kind of like, it'll move you through it and really help, like it assists in the moving through the whole thing. But the whole process is pretty fast. It's one of the things I really like about it is, nothing lasts for a long time. Other medicines, if you do LSD or psilocybin, you could be in it for 8 hours and some dark things can come up on ketamine, but it's so fast. You're talking minutes, rather than like hours. So, and it just kind of, you're just moving through it and the whole thing is over in about an hour. So if it does go dark, you move through it and you can look back at it and generally people don't even remember they had a dark experience, but it happens. And then it's just like you move through it, you experience that whatever that was difficult. And then you get to the other side. You're like, I did that. I moved that really hard thing and I was able to handle it and I'm okay. And I think that's something people can really bring into their daily lives of just like, I can handle this. I've done hard things. That was really hard and I did it, but you're just like minutes rather than hours.
It feels a little empowering, when and a lot of patients are afraid of being in that space. And once they go into that space and come out of it, there's a bit of a, I don't know, some people call it like a hero's journey, or it's like, yeah, I was afraid of doing something. I did it. I faced whatever fears were in there, and now I'm out on the other side. So it can be a little empowering too for patients to feel like, I am bigger than my trauma or whatever. So.
Right. And then, so how long do these sessions go for? Because I know with therapy, it's weeks and weeks upon end. How long do therapy sessions typically tend to last?
Each individual session lasts about 2 hours. And then we recommend doing a series. There's some statistical evidence to suggest there's a benefit of doing it more than once. We recommend a series of 6, and 6 is kind of an arbitrary number just to, you need to take a break after the series and just see what you get out of the experience. So up to 6 sessions, and then, either weekly or bi-weekly, and then take a drug holiday, see how you feel, see what you pull out of it. And oftentimes we'll have people come in maybe quarterly or twice a year for boosters, just when they kind of start feeling the benefits wearing off. So it's kind of individual after that.
Yeah. So 6 is, like you said, it's just a number they did studies on. It's not a magic number. I'm not going to ever tell anybody you do 6 sessions and then you got it. But 6 is a great number for us to see some pretty big changes. And we typically will see changes after 1 or 2. But 6, if we don't see any improvement after 6, we're not going to encourage people to continue on. Not to say that they couldn't benefit from it, but we're more, 6 is a really great number for us to kind of know if it's going to work for them or not, if something's going to change for them. And we generally do see changes within 6, not 100%.
Some people don't, but we certainly don't want to keep doing something if it's not working. But most people find benefit.
Okay. Also, too, you were talking about earlier how ketamine doesn't do the work for you. Let's say like they're done with the ketamine therapy, what kind of work would they have to keep doing to manage? Like,
we always encourage people to be in therapy, seeing a therapist. And we usually recommend in between sessions that they see their therapist to kind of process the stuff that comes up. We offer a integration group weekly, just on Zoom. And then we also for you, where you let someone with a history of addiction, where you've been involved in 12-step, obviously I would encourage people to continue doing their 12-step work and going to meetings, and then just also self-care, taking care of your mind and your body, getting exercise, good diet. So it's a holistic approach, but ketamine's just a small piece of that, where you got to do the other stuff to kind of take care of yourself, the hard work. Yeah.
Right.
It is just a tool, but it's like a power tool. It's really cool. It's one of the reasons why I'm so excited about it is, as a therapist, I'm not going to say it's magic, but there's a little bit of magic to it, because it does really help people break through and open up and come in contact with what they need to feel to move through their stuff. So a lot of times, we create coping mechanisms and ways to protect ourselves. And it's so great that our brain is amazing that we can do that. And it's wonderful. But a lot of times these coping mechanisms, like disassociation and all the things we do, coping mechanisms aren't inherently bad. They're just what we created to get through and to get us where we are now. And so, ketamine, as a therapist, I'm pretty excited about it, because now it's not going to do everything for you, but it really does connect you to parts of yourself that you might not have access to because of the coping mechanisms that you created to survive and to continue on. And so, it doesn't do it all for you, but there's something really cool about it that I've seen with patients that I didn't see before, just doing talk therapy, or even just doing trauma therapy. I mean, a lot of times, trauma is stored in your body, and there's a little bit of a kind of a hack to get into the stuff that you hold in your body to help you move through it and feel it and move, basically move through it in ways that traditional talk therapy hasn't been that great about.
So I like what you guys said about how it really helps you open up and everything, because I do therapy and sometimes I do have like a roadblock. Sometimes I don't want to share some things and whatnot. So I can see how ketamine can help open you up. I don't know if it's similar, but like I feel like on these like holistic treatments, ayahuasca is like up there. It's like super intense, right? You go to a place that's professional, it's legit. You see a shaman. It's like a few days, and there's like a lot of purging involved. It's very intense. It's like 0 to 100. And now I'm seeing ketamine is like, maybe it's in between. It doesn't last as long. It's not as intense. You go multiple times. It's definitely not as intense. Maybe it's something people might consider if they want to do something like ayahuasca, but that's too intense. Maybe ketamine might be more realistic and safe for them. Is that kind of accurate?
In between medicine. I mean, I kind of consider it like a light psychedelic. Not to say that for everybody. Some people have some really intense experiences, but I think it is a little easier. It's a little more accessible. You're in for 2 hours rather than multiple days.
Yeah, no, I agree. I think it also seems to have a little more foot in Western medicine. And for some people, that feels maybe like some security where, licensed professionals, are, kind of watching over you. I think something like ayahuasca is very powerful, but this is more of sometimes, I don't know if it's the right way I sometimes look at ketamine as maybe a gateway. And some people do move on to those more powerful experiences, but some people ketamine's enough for. So it is just a different, just a little bit. The way you described it was pretty good. It's kind of, a little more, it feels a little safer than kind of going wherever you would go to do ayahuasca or some
Right.
more involved.
Yeah. And going back to addiction, like you were saying, there's definitely a lot of trauma. Like I experienced some trauma growing up, and it's just using was definitely just the thing to do. It was a thing to escape. It's interesting that you told me that a lot of people in 12-step go to do ketamine treatment, because I can see it being very beneficial.
Yeah. And I'm not very familiar with 12-step personally, but I do know that in the early days before it turned into what it was there. I mean, and even today there is the connection with your higher source, right? Or your higher power. And I think early on, they did use psychedelics early on, like before it became what it is today. The guy who started it, Bill, I can't remember his name. There was use of psychedelics because that does connect. There's a little bit of connecting you to your source or to just maybe spirituality, and that is one thing that I think ketamine can do. It can connect you to your spirituality. It can be a spiritual experience. It can. I'm not going to say everybody has that. Everybody has a different experience with what they believe, but there's something about that kind of connects you to like a feeling of hope that you might not have before. So I think that it goes along with 12-step. Not everybody's going to agree with me there, but I think there is that piece of like connecting to your higher power that ketamine can help with. The other thing that ketamine, and I know we're almost out of time, but I wanted to say ketamine is really helpful with helping, and other psychedelics are really great at helping you connect with your self-compassion in ways that all of the things I knew I should do before I ever tried, did my own work with it. All of a sudden I started to know, and like I had started to feel it rather than just know it. And what I mean by that is just like having self-compassion for myself and being kinder to myself. I see that with so many people that they are all of a sudden able to have this compassion, this self-compassion. And we really need that to heal. We need to be kind to ourselves, and we need to have compassion and have an understanding of where we've come and why we've done what we've done and how we got to where we are. And I think that's really important when we talk about ketamine and using that in therapy, is can really connect people to that in a way that they couldn't connect to before. And psychedelics in general are really great at helping with that. But yeah, so that's something I hear a lot from people.
Right. How much time do you guys have? I got a couple more questions, and I think it's like going pretty well. A little bit more time. Yeah. What I also liked about ketamine is I felt a little, this is my personal experience. When I was introduced to psychedelics, I was very hesitant. I told myself, this is a really long trip. I never knew if I was in the right mindset. I always heard that if you're not in the right mindset when you take this, you're going to have a bad trip. Something's going to, you're going to have a really bad time. And for me, I never really knew. I think deep down, even when I was using, I knew I was in the right mindset. Like deep down, my subconscious, I knew if I was in the right mindset, I would not be abusing drugs all the time. Sure, maybe recreationally, but deep down, I just knew like, man, I felt like I was opening up a can of worms or something's going to like really ruin my day the next few hours. But with ketamine, it was a cool in between because I liked it. I really did enjoy like how good it made me feel. And I felt like similar to MDMA, like super compassionate, you know? So that's something that I noticed with ketamine.
Yeah. I mean, I think that's a common fear, I think, with psychedelic drugs in general is like, what is it going to unlock? Like, and there is that fear of your subconscious is pretty vast and there are things there that we have repressed. And, I think if you go into it, you may not always be in the perfect mindset, but if you go into it with good intentions of like, I want to see where I can work on it, usually, even when those hard things sometimes get unlocked, it's usually that can be very kind of helpful to unlock them. And okay, here's something I wasn't aware of that I want to, there's very obvious ones like, as you said, you when you were using, you were like, okay, I already know what I need to kind of fix. But if it kind of helped give you some insight or self-compassion into, okay, well, how do I start to work on fixing that? That can be very powerful as well. So there is the unconscious stuff that we haven't unlocked, the reason you self-medicate, and then there's the obvious stuff that weighs on our consciousness but yeah, I mean, mindset is important, but I think you can kind of counterbalance that with kind of intentions to do work rather than just self-medicate. So, yeah.
Also with ketamine too, I felt like I felt okay doing it alone, but with psychedelics, I was like, I don't know if I should, because typically you need somebody there. Well, and if you're like new. So I think the last question is, you've talked really great things about ketamine therapy, benefits, how it's helped with depression, addiction, and other things. Like, what should people be mindful of before going into ketamine therapy? And when wouldn't you recommend ketamine therapy?
What was the last question?
When wouldn't you recommend ketamine therapy to somebody?
When somebody,
Okay.
okay.
Oh, yeah. Usually, there's a little bit of a screening process. I'll usually see patients do a psych eval. If somebody's actively intoxicated, usually we've had patients come in on opiates and with the intention to like, I want to use this drug to kind of help me detox. Usually we require a little bit of sobriety. It doesn't, before usually we want them engaged in some sort of therapeutic process, whether that's individual therapy, so expectations around it, other stuff, mental health issues like acute psychosis, like somebody that's schizophrenic or even bipolar that's manic. We don't want to exacerbate or make the situation worse, make the psychosis worse or the mania. So there's certain psychiatric diagnoses we would probably say that it would be a bad idea to give somebody ketamine. Some other instances where we've turned people away, we've had patients' family members pushing them to do ketamine, family members wanting to fix that patient, and oftentimes we want the individual to be motivated, rather than somebody else kind of strong, forcing them to do the treatments. That's definitely a no-go. So I can't think what other situations do we tend to.
Not talk about what to be mindful of when you're doing it. I would say, choosing the right clinic, doing a little research, looking at reviews, making sure, finding out and asking questions to find the right clinic. There's a lot of clinics out there now. They popped up a lot. When we started, there weren't a lot, but there's a lot now. So just being, just doing your homework and choosing the right clinic that feels good to you. Not that everybody's going to even tell you if they've done it or not, and maybe it's not necessary, but I found that trying to find somebody who has done work with it and they know what they're sending you into I think is important. It's just my own personal opinion, but I think it's important that someone who's going to give you this would have some idea of what they're sending you into. So just ask questions on that, and do a little assessment of your own coping mechanisms and your ability to. It can unlock some things, and it can shake you up, and it can create some big emotions and feelings, and so just making sure that you're doing good self-care, and maybe that even people, a loved one knows you're doing it, because it can really shake things up, and it can lead to some. It can be difficult, so having some support, if you have it, is good, and if not, making sure you find a clinic that does offer some help or support beyond just giving you the ketamine.
Right. I also like what you said about people who administer the ketamine therapy have also gone through it themselves. I strongly believe in that, because for me, if somebody, it's obvious, but if somebody who's never touched drugs told me you gotta stop doing drugs, I'd be more inclined to listen to somebody who's gone through it. You say, hey man, like, I've been through it. Like, let's talk. I feel like it comes from a place of experience. Like, oh, they've been through it too. They know what they're talking about. So I definitely agree with that.
Yeah, I think it's helpful. And not everybody's, you're not going to always have that, but I think it's really helpful for the process. So, sorry.
Oh, you're good.
It's going through the computer. Sorry.
Right. Also, like, I guess, are there any side effects, I guess, that comes with it? Let's say you do the ketamine therapy and it wears off. Is there anything that people should be aware of? Like, does it kind of affect you afterwards, or is it kind of just gone?
Well, sometimes it can bring up hard stuff emotionally, and we've had patients say, they didn't like what it brought up and feel like they're still under some sort of influence of ketamine, which is not really possible, like days out. So whatever it brought up is kind of manifesting sometimes in a physical, kind of way for patients. That's rare, but sometimes that happens. The most common side effect really is nausea. Most people, it's usually tolerated well. About 10% of people get really bad nausea with it. So that's about it.
If they do, we can pre-medicate with some, Zofran or something like that to help avoid that the next time.
Yeah. This is when I was using ketamine, I kind of liked it because there wasn't really there was some sort of a come down. It's like a stuffed nose, and I was kind of out of it, but it wasn't like super intense.
Mm-hmm.
But yeah, I think that concludes the episode. Thank you guys so much. Do you guys want to shout out your clinic, where you're at? Maybe people are interested.
Yeah. So the name of the clinic is Ketamine Therapy at Therapeutic Alternatives, and we're located in Salt Lake City. Our website is ktherapyslc.com.
Okay.
Yeah.
All right.
I think we're on Instagram. Well, we're on Instagram. I can't remember. I think it's Ketamine SLC. It's on our website. I'm sorry. I don't know.
No, you're good. You're fine. It's funny. When I was searching up ketamine therapy on Instagram, right away it says your input, whatever you search, ketamine therapy. Oh, it sounds like you're trying to buy drugs or sell drugs, get some help. So I'm oh, so okay. So I had to find it through I think threads, Instagram threads. But if you type in ketamine on Instagram, it's gonna think you're trying to buy drugs or sell drugs.
Yeah, it's pretty touchy of how you use the word ketamine on Instagram and Facebook and stuff. Our Instagram is called ketamine-therapy-SLC. And then we've got that website. But yeah, we have to be pretty careful because they don't like that word. The internet doesn't like that word.
Yeah. Well, thank you guys again so much. I really
You're
appreciate your
welcome.
time.
Thank you.
Thanks for having us.
Yeah, no problem. I'm going to stop the recording here.